NAMI Dane County is the founding chapter of the National Alliance on Mental Illness, and we're the largest grassroots mental health organization. And we provide education, advocacy, and peer support to individuals impacted by a mental illness, including loved ones and family members. We started here in Madison back in 1977. And we currently have affiliates in every state in the United States of America, including over 40 in the state of Wisconsin. And so I want to highlight that just because even if you're not in Dane County, if you go to NAMI Wisconsin, you can find if there is an affiliate close to where you're living. Some of the services we provide support groups, including youth support groups. We provide education classes for caregivers, for individuals living with mental illnesses. We also do presentations in the community. And then at NAMI Dane County, we also have a support line that people can call in, and we can help connect you to resources in the area. Next slide, please. And I would just want to share that tonight, I'm just here to just share some a broad overview of mental health conditions within children. And then I know other folks will be talking more specifically. So here's some data nationally, which sometimes surprises people, but about 50% of mental health conditions will present by the age of 14. So I think this is earlier than a lot of people thought when we would talk about mental health conditions and mental illness, is that it was something that impacted adults, but it's clearly not that what we see. And then again, 75% by age 25. Some of this data is pulled from the Centers for Disease Control and Prevention. And so this data was from a study back in 2005 to 2012. So you can see the prevalence of the most common mental health conditions that we see in children. So again, ADHD is pretty high, followed by anxiety disorders, and then depressive disorders, and then a more general diagnosis of behavior disorders, which can be deceptive because that could actually be a manifestation of other things going on with children. I would say right now, looking at what we had in 2019, the most prevalent mental health conditions that we saw in children were anxiety and depression. And I think the other thing that folks need to be aware of is about 50% of kids actually get treatment for their mental health conditions. And so that means that 50% are not. So we really have to be mindful that there are a lot of children out there who might not be receiving the treatment for something that is treatable and manageable. I would also say with the pandemic, what we see is the rates of mental health challenges for children have steadily increased and are probably at an all-time high right now. So that's a little bit, and there's a link to the study if you're interested in looking more at that. Next slide, please. So this slide just kind of talks about some general things. And again, I think you're going to hear some of these things over and over tonight, which is good because it really affirms that a lot of us working in this field are actually saying the same things and they work. And so these are just some tips for if you are concerned that perhaps your child does have a mental health condition or is struggling in their mental health. And I think the most important thing is really having open communication, setting aside that time to talk about how are you doing? What's been difficult for you this week? Do you feel like you need some more help? What can I do to help you? Really building that into your weekly routine with your children, and maybe even every day, depending on what's coming out of those conversations. I think even with school and the disruption for many of us that's going on with our school routine, it's still important for our children to have routines. So make sure that you have a routine in the morning. Make sure that kids are getting all those things that we know that are good for them, like rest, healthy food, exercise, time to relax, not on screens, preferably, and also time to get together with peers, whether that's over the phone, virtually, or in a safe physical distance outdoors. I think the big thing, if for other parents, I would say, We all have up and down days, and that's no different for children. But if an up and down day turns into up and down weeks, if you notice something, a difference in your child's behavior, don't be afraid to ask and let them know that you can help them seek the help that they need. I think this is also super important because we're dealing with the pandemic, as well as the election, as well as the tremendous amount of racial injustice that's taking place in our country, that you really have to be mindful of limiting social media for children, and also checking in on yourself. I think too many times as parents, we might be watching something thinking nobody's listening. Well, kids are the best listeners out there, even if they don't show it all the time. So making sure that you're really setting some guidelines around what children are being exposed to. And I think also too, another really important piece is being able to talk about your own mental health, being able to take care of yourself, and also acknowledging if you're struggling, sharing that with your kids and actually talking about what you're doing to deal with that, cope with that, so that they can understand and normalize that it's okay to not be okay. Next slide, please. So on this slide, I just wanted to put out some different resources that exist within the state of Wisconsin. Obviously, NAMI Dane County, we're more local to the Dane County area, but we can, even if people contact us, we can push you out to other affiliates. There's also NAMI Wisconsin. I would also highlight Wisconsin Family Ties, especially if you're a parent with a child that does have a behavioral or mental health challenge. They do a great job providing parent peer support, so they can help with advocacy in school, advocacy in the healthcare, all kinds of different stuff. Wisconsin Facets is another excellent organization that has ongoing trainings throughout the year, so you can get more information, as well as WISPE if you're looking more for, and I should have written what it stands for, but I think it's the Wisconsin Statewide Parent Educator Initiative. So that's another place if you're looking for that connection between school and mental health. We have a support line, so you can call in, like I said, and we can direct you. And then also to a couple of other ones, suicide prevention hotline, very important. If you think that your child or youth may be struggling or thinking about suicide, this is a great resource for them or for you to reach out to. And then at the very bottom, there's a link to a really nice video that was made by NAMI Wisconsin that really talks about what does mental health and mental illness look like in children. And it's really put forward in a very developmentally appropriate way. So I, copy that URL and then check it out. I think it would be great for parents and great for schools as well. It's very user-friendly and developmentally appropriate.